Hello and welcome back to
OPod.
OPod. Today we're doing the final segment of the collaboration with UCL and we'll be discussing anxiety today with Dr. Oliver Robinson.
Thank you for speaking with us today, Dr. Oliver Robinson. Your title is Professor of Neuroscience and Mental Health. What motivated you to pursue a career in mental health, and what are some key questions you were trying to answer in your research?
So I've always been interested in people, interested in how people behave and how they react, which made me, interested in psychology, and trying to understand what makes people tick. I also, when I was doing my A-levels and stuff in school, I was really interested in biology, and like more sort of, not humans like as a sort of whole animal, but like more cells and how things. And so that led me also interested in like neuroscience. And so basically throughout my career, I've started, I've done studying the brain, studying how the brain works, and then also studying how humans interact and their psychology. And so sort of marrying the two together, that's where my title comes from. I'm looking at the neuroscience aspect, so how the brain works, but then also the mental health aspect of it, so psychology and how people interact with each other. So broadly speaking, what I'm interested in is how do common mental health problems occur at the level of the brain? Like, everything that we do is contained within the kind of constraints of our body, not just the brain, but also the whole rest of your gut and your stomach and so forth. But it all's coming from within here, obviously in reaction to what's happening in the environment, but like the feelings are coming from within here. So that's what we're trying to understand. It's also a really difficult challenge. Like, we don't really know anything about the brain. We know, we're all right at treating mental health problems, but there's an awful lot of people that we're unable to treat. And so a better understanding of this kind of thing, in addition to being fascinated in it, I also think it's really important to be able to help people. So that's broadly speaking what got me interested in it. But it's going to keep me going for a whole career because, as I say, it's super complicated. We're not nowhere near to fully understanding anything or really close to solving any of the problems that we have, unfortunately. But we're getting there.
The clinical term for anxiety and depression is psychological distress. Can you explain what psychological distress might look like?
So psychological distress is a term. It's not the only term that describes anxiety and depression. Anxiety and depression are, their own things in a sense, but what's common to both of them is some degree of psychological distress. What's kind of interesting, especially about anxiety, is that in addition to, they're normal feelings. Everyone feels anxious, like it's actually useful. Like perhaps when you're doing a podcast or whatever, you might feel a little bit anxious. And that's helpful. It gets you on your toes, makes you a bit more focused. Or, if you think about a more traumatic environment, walking home in the dark or whatever, you feel a little bit anxious. That's going to prime you to detect the stranger lurking in the corner or whatever. That's a helpful emotion. And so you could say it's psychologically distressing, but it's also useful, right? But what happens with anxiety disorders and depression is that useful function, you might also experience it at other times. And that's when we might refer to it as sort of distress, psychological distress. So to give the example of walking home in the dark, you might feel anxious. Then you get home, you're having a cup of tea, everything's safe, you're all okay, that anxiety should slowly dissipate, right? But in some people, it doesn't. It stays, right? And it stays throughout the day, throughout the night, and it ends up getting in the way of going about your daily life. So with anxiety, what can happen, this is one example, is, especially with social anxiety, people might find themselves like really worried about, embarrassing themselves, right? So I don't want to go out to that party because, I'll say something stupid and then I'll hate myself. And what that ends up doing, and in extreme cases, is people might not leave the house, right? And so that's an example of where that kind of feeling, which can be useful, becomes more pathological, and it's, within the realm of psychological distress. The thing is, when it comes to these mental health conditions, we have terms that we use colloquially, I'm anxious, I'm stressed, or what have you. There's terms that are used clinically, like, generalized anxiety disorder, post-traumatic stress disorder, distress and things like that. The definitions are kind of sometimes useful, sometimes not useful. I mean, fundamentally, the thing that makes something a problem is only known to the individual and the people around them, right? Because for one person, some kind of extreme trauma is, water off a duck's back. For another person, it's getting in the way of their life. And so where you draw that boundary is going to depend on the individual and their experiences. But, it's not necessarily helpful, I think, to get caught up on terms or diagnoses. Like, some people find it very helpful to put a label on something. Some people find it not helpful. So, it's all a bit blurry, basically. But yeah, that psychological distress would be something where it's getting in the way of your ability to go about your life, basically.
So the other one we call more like flight or flight, like just everyday.
Yeah,
you know?
so fight or flight is again, that's more like the adaptive function. You know, you're in the forest and you see a bear, right? I don't know why it's always a bear in these examples. We have bears, but you know, you see a bear and you're like, oh my goodness, what do I do? Do I run away or do I fight the bear, right? I mean, if you're crazy, you fight the bear, and obviously then you die. But that is a normal adaptive function to seeing a bear, right? But if you have that fight or flight response, you know, when you're just talking to the person at the ticket counter on the tube, that's not helpful at all, right? Because you're just trying to buy a ticket for the tube or whatever. So it's when that thing that can be useful in certain circumstances is engaged at inappropriate times that then we think of it more as a disorder. But, you know, most people are going to oscillate between periods of this, and it, you know, everyone at some point will feel anxious. Everyone probably at some point will feel anxious inappropriately, at least, you know, in their minds. But not everyone does it become crippling and preventing them getting on with their lives. So, you know, I think it's better in a sense to just not worry too much about the terminology when it comes to mental health, and it's more about the individual. When it comes to the science, on the other hand, obviously we have to be quite specific and precise about the definitions, and we can talk more about that if you want to. But from the sort of, you know, as someone who feels anxious, it sort of doesn't matter too much, if that makes sense.
That sounds a lot like social anxiety. If you're in a social environment and you have a fight or flight response.
Yeah.
That sounds a lot like social anxiety.
Yeah, so the clinical term would be social anxiety disorder. Yes, it's exactly what it is. If your anxiety is associated with that particular environment, but we have different flavors of anxiety disorder based on, you know, the environment. Generalized anxiety disorder is kind of like, it could be social, it could be, you know, worrying about being in a car crash or worrying about, you know, whatever, like sort of general stuff. Post-traumatic stress disorder is obviously associated with anxiety, but that's with a clear traumatic event beforehand. They're all flavors of disorder, as it were, that are associated with anxiety. No one is, you know, easier to deal with than any other, really, but sometimes when you know what the cause of the problem is, in the case of social anxiety, then that can lead to certain types of treatments. And so, for example, one of the most successful psychological treatments, so when we treat anxiety disorders, we have medications and we have psychological treatment. Some work for some people, some work for other people, some work for nobody. So some people don't, neither of them works. For some people, neither psychological nor pharmacological medication work. But when it comes to psychological treatment for social anxiety disorder, one of the kind of key treatments actually is to make people face their fears, as it were. So if you're worried about a social environment, social situation, generally what it is you're worried about is, oh, I'm going to embarrass myself and then everyone's going to think I'm an idiot, right? That's often a symptom that people have. So one of the solutions is, okay, let's go and have a social environment. Maybe we'll organize it. Maybe you go to the party and then tell me afterwards, how did it actually go, you know? And then you go to the party, you come out, well, I didn't embarrass myself that time. Okay, that's good. So what you were doing was you were telling yourself that was going to happen, but it didn't happen. So maybe the next time, think about it, and then maybe you go to the thing and see what happens. And it's actually very effective for some people, basically, facing their fears, as it were.
Oh, so it's like exposure therapy?
It's exactly what it's called, exposure therapy, yeah.
Okay, cool.
Yeah, that's right.
You published a paper in 2019 called "What Does the Hitchhiker's Guide to the Galaxies Have to Do with Our Understanding of Anxiety and Depression Symptoms?" Can you share what you found?
Yes. So that actually was a sort of, what's the word I'm looking for? It was a kind of an addition to a paper. The paper itself was kind of a dry scientific paper. I can't remember what the title was, but it will have been quite boring. This was kind of like a more fun summary of it to try, you know, to hopefully make it a bit more interesting for people who aren't weird, i.e. people who aren't scientists. But so basically, what that was about was we're trying to use sort of new technology to understand anxiety. So you'll be familiar with artificial intelligence and, you know, how it's going to take over the world. But it's also quite useful tool for people like us because we can develop artificial intelligent agents or robots. You know, they're not really robots, they're in computers, but let's call them robots for fun. And we can make them do stuff, right? So one of the things we have in anxiety is that it changes how you behave and it changes how you might respond to choices. So if I give you a choice between going with A or B, and A is less good, or you know, you've gone two restaurants, one is better than the other. If you're anxious, you might go for the restaurant that you know to be better, for example, or even though the one that's worse might have, you know, one really good thing on the menu, but the other stuff is bad. I mean, this is not a great analogy, but anyway, the point being that if you're anxious, it changes how you make these choices. Okay, now if it changes how you make choices, what we can do is we can make robots that also make those choices, right? And we can change the sort of workings of those robots to make them behave like the anxious person compared to like a control person. So that's what we did in this study, actually, is we had people do a very simple task, which was a bit like choosing restaurants, which is why I got stuck in that stupid analogy. But we had lots of anxious people and lots of healthy individuals, real people, perform these simple computer games where they're making these choices. And what we see is that the anxious people perform differently. And actually what happens is the anxious people, if something bad happens after a choice, they're less likely to choose that again, which makes sense, right? You're anxious, you don't choose the bad thing again, okay? But we don't know why and what causes that. So what we can do is take that data and then we can essentially train our artificial intelligent agents. We can train our robots to behave and perform that task. What that means is we can basically make this army of artificial intelligent agents that perform like the anxious individuals. The reason that's like Hitchhiker's Guide to the Galaxy is what we've essentially done is we've made an army of robots that are like people who aren't anxious and an army of robots that are like anxious individuals. Now, in Hitchhiker's Guide to the Galaxy, there's a character called Marvin the Paranoid Android, which I'm probably dating myself with this reference. I think Hitchhiker's Guide to the Galaxy came out in like, I don't know, 70s or 80s or something. But it's also referred to in the Radiohead song, Paranoid Android, which came out in, I don't know, probably the 90s. Again, dating myself. So Marvin the Paranoid Android, it's a joke, right? It's an anxious robot, right? He's roaming about the spaceship going, oh, everything's terrible, everything's going to be bad, right? And it's kind of silly, right? Why would you build an anxious robot, right? Well, the reason we did that, we built anxious robots, is that once you've done that, you can actually start to pull apart what you've done in your sort of AI mechanics, the machinery. Oh, we tweaked this cog, this parameter, this bit of code or whatever, and that's what's changed the behavior and it's made them behave like an anxious individual. And to cut a long story short, there's lots of different parameters, lots of different ingredients that can change the way you behave. And in that one study, what we showed is it's something called the aversive learning rate that changed when people were anxious or our robots were anxious. And what that means is when people are anxious, it's not so much that they dislike bad things more. If you're anxious and I give you a bad piece of news and you're not anxious and I give you a bad piece of news, it's not like the anxious person finds that bad piece of news more aversive, they don't like it. Nobody likes bad news. Everybody dislikes bad news. What's different about anxious individuals is how quickly they change their behavior in response to that bad bit of news. So whereas someone who isn't anxious might get that bad news day 1, day 2, day 3, okay, finally I might change my decision. Someone who's anxious might change it immediately, right? And we see this clinically. So a common anxiety problem is fear of like problems happening on public transport or like a plane crash, for example. Now, we know plane crashes are very, very rare. So if you hear about a plane crash on the news, you might go, well, that's terrible, but loads of planes fly and they don't crash every day. But if you're an anxious person, you hear about that, you might be right, I'm never flying ever again. What that means is you've changed your behavior much faster in response to that bad piece of news. Now, we were only able to get to that kind of particular mechanism of anxiety by going through this whole process of building this army of anxious robots, if that makes sense. And this is a part of a field, this kind of newish field called computational psychiatry, which is basically trying to use the tools of computer science, artificial intelligence, and things like that to model the computations that the brain is doing that leads to anxiety. Now, this isn't going to help someone immediately get treatment, but that bit of information, okay, it's about changing your relationship with your behavior and how you change your behavior in response to bad news. That could eventually help us, tailor therapies to individuals, for example. So rather than try to tone down how they respond to something, maybe you should, like we talked about with exposure therapy, do the thing again, and don't change your behavior. Do the thing again, don't change your behavior. Okay, was it fine? Yes, it's fine. Okay, so now we're modifying your learning rate, as it were. But yeah, so basically, in that paper, we tried to build anxious robots, basically, is where the title comes from.
Can I bring up, sorry, quickly?
Yeah.
It was in the Teams meeting that I watched. You basically said that you use shock therapy.
No. So not shock therapy. No,
What
so shock therapy is a specific type of treatment for treatment-resistant depression. Electric convulsive therapy. It's the one that you see in like One Flew Over the Cuckoo's Nest, right? It's the sort of example of like terrifying psychiatry, like strapping people down and shocking their heads. Now, it is actually still used.
Is it?
Yeah, and it's used in very rare, not that semi-rare cases where nothing else works, and it is actually pretty effective. Now, these are people who their depression is so bad that they've maybe had multiple suicide attempts, they can't really do anything, like everything is extremely traumatic. And in a few of those people, and it's not without controversy, that's true, but it is a recommended treatment for people for whom nothing else works, basically. And it might be the choice between something like that and it works for you versus eventually them taking their own life. So it's a very extreme type of treatment, not used very commonly, and certainly not in the sorts of anxiety and depression we're talking about now. This is extremely common. This is something like 25 to 50% of people experience these symptoms. You'd never be getting electroconvulsive therapy.
I'm never worried about that. Good to know.
But what we do, we don't do shock therapy. What we do is we use electrical shocks as a tool to understand how what happens in anxiety. So, and the reason we do this is because different people might find certain things. So some people hate spiders, for example. I don't mind spiders. Yeah, there you go. You hate spiders, right? So we could try to study your anxiety by using a spider. Sorry, I'm doing it again. We could try to study your anxiety by using a spider as a sort of negative cue, as a bad thing. Yeah. But that will only work for you because you don't like spiders. Wouldn't work for me because I don't mind spiders. Now, the thing about electrical shocks is what we do is we will attach them to people's wrists or ankles, right? And we can give you a little bit of a shock, and you go, "Oh, that doesn't bother me." And we can get it to a point where keep increasing it, and everyone at some point is going to be, "I don't really like that." Okay. Now, it's not like extreme agony, right? The example is the feeling of an elastic band, right, like slapping against your skin. So it's not awful, but it's not fun, right? But the advantage is that we can change that for different people, and we've got now a stimulus, unlike a spider, that everyone doesn't like. Okay, so now what we can do is we can study how you behave in response to that negative outcome. So one of the things we do in our studies is we look at when we tell you, okay, that shock that you don't like, at some point that's going to happen, right? So imagine I'm asking you to do a simple computer game, and normally you're just playing that game, right? But then I go, okay, right, continue playing that game, but at some point you're going to get an electrical shock. Right? It's got nothing to do with the game itself, but that might come at some point. You're probably going to be like, this is horrible, what are you doing to me, right? So that is anxiety, right? That feeling of expecting this bad thing to come is the feeling of anxiety, right? And so we can then say, now you're safe, now you're at risk, now you're safe, and we can look at how it changes your behavior. And that's actually what we did in that study with the robots, is we looked at how healthy people's behavior changed when they were at risk of getting electrical shock, when they weren't. And so we're making healthy people anxious and then not anxious. Okay, so now we can use that as a way of studying anxiety. But it's a way that works for every single person. Now, obviously, all of our studies are, voluntary with consent, and probably there are certain people who would never participate in one of those studies because they don't want to get electrocuted, right? So we're actually studying probably a slightly biased sample of people, but it's one of the best ways we have of manipulating anxiety within the lab. Now, one of the nice things about it as a neuroscientist is that you can do the exact same manipulation in a non-human animal model, right? So you can do the same thing to rats, you can do it to monkeys or whatever, which allows you to do slightly more complicated things and study different things than you would be able to in humans. So that allows you to actually get closer to understanding your neurobiology, because different animal models have certain relationships to human models and things like that. So we can actually, better get closer to understanding what's happening in the anxious brain, as it were. But no, we don't use shocks as a therapy. It's far from it. We're using shocks to make people anxious, but only a little bit. It's not, it's not awful. Otherwise, people wouldn't do our studies.
Are there certain demographics that are more at risk of developing psychological distress, and why is this?
Yes. So, the thing to remember is that these are all general. So yes, there are certain demographics, but it's not to say that if you're within a certain demographic, you're definitely going to become anxious or depressed. And if you're not within that demographic, you're not going to become anxious or depressed, right? It's all kind of broad. Now, things like depression and anxiety, we know, are much more common in women, for example, than men. When you look at the diagnoses. Now, that might be because the underlying neurobiology and the underlying vulnerability makes women more vulnerable, but equally, it could also be that because of society and the way we set things up, men are less likely to talk about their mental health and things like that. So, but it's probably a bit of both. Generally speaking, pretty much all psychiatric and mental health conditions are more likely in people with difficult upbringings. Now, that might be for all sorts of reasons, childhood trauma because of, the family environment, but also minoritized status, like being an immigrant, being in an environment that, is unfamiliar for you. Like all of these things can contribute to it. But it's sort of broadly speaking, any mental health problem is a combination of, your underlying vulnerability and your the environment that you're in. So you might have a really high vulnerability because of your background or because of your underlying genetics, for reasons that nobody really understands, you're more likely to become anxious. But because you're in a supportive environment, you don't then develop it. But equally, there are lots of people with a completely supportive, normal, healthy environment that become extremely anxious and depressed. So with any of these things, it's kind of generalized. Generally, women are more likely to become anxious. People with difficult upbringings are more likely to become anxious and depressed. But it's not a kind of
So anyone can be a victim, basically.
anyway. Exactly.
We're all.
But importantly, is like trying to understand why those things happen. We know, for example, that a lot of mental health problems occur postpartum, so like postnatal depression and things like that. So obviously that's only going to happen, generally speaking, to women who've given birth. But so that's one factor that might make women more likely to experience these things, and also just the environment. So the social environment we live in, we live in a patriarchy, etc., is going to make things difficult for. But all of these factors, it's a very complicated, intermixing of vulnerabilities and the environment that you're in, basically. So we don't really know why people are more likely to become anxious or depressed, generally speaking, but there are these general kind of rules, as it were. Rules isn't the right word, but these general risk factors.
Okay, so anxiety
Yeah.
can affect anybody.
Yes.
But I feel like in my personal experience, growing up, I never suffered with anxiety. But as I've gotten older, and I feel like everybody is just so much more aware of their surroundings and there's so much more to be self-conscious of,
Mm-hmm.
I've become anxious in situations that I wouldn't normally
Yeah.
care about.
Yeah.
So I don't know if it's a case of people being more anxious these days or just the fact that our environment has just become so much more, there's just so much more pressure in our environment.
Yeah, so all of these factors are probably true. So I think that on the one hand, there's a lot more awareness. So back in the day, stiff upper lip, there's no such thing as anxiety, right? People were probably anxious, they just didn't talk about it, right? So that's definitely a contributing factor, people being more aware of it and being more willing to talk about it and being, therefore, recognizing it themselves. There's definitely a factor of, as you get older, you accrue more experiences and, you've been in situation A, B, and C before and bad things happen. So therefore, you're going to be wary of encountering that. Whereas as a child, you've never experienced A, B, and C, and therefore you're not anxious about it. So as you get a little bit older, you do start to accrue these experiences. Actually, anxiety and depression, like the earliest sort of age of onset is around the teens. So, and that's a period of massive social change. It's when people go through puberty, they start to understand that they're a part of a social environment. When you're a child, everything's very simple, right? You give given some rules and you don't have to worry about it. Once you're a teenager, oh my God, all of these hormones rushing, you've got to worry about stuff. So definitely, I think as people get older, it does increase. Now, interestingly, with things like anxiety and depression, as you get even older, they start to decline. So as people are elderly, actually they have the lowest rates of things like anxiety and depression. Now, that's not to say that there isn't examples of depressed or anxious elderly people. Of course there are, but it's, as you get older, these things decline. But then there's also all these other factors. We're a much more connected world now. Hundreds of years ago, you might only know about what's happening in your immediate environs. Obviously, you're going to get anxious occasionally, but you're not worrying about a nuclear apocalypse, climate change, all of these factors. We're not, 24/7 news cycle finding out about stuff all the time. All of this is probably contributing to people's anxiety. But again, it's a complicated picture, and we don't really know how much these things contribute and how much they don't. It seems intuitive that the more you find out about bad stuff happening in the world, the more anxious you're going to be. But, it's not clear that leads to more anxiety disorders. I mean, it might make you sort of feel low-level anxious. But your experience is not uncommon. The thing I often say with anxiety and depression, yes, we have these diagnoses. Yes, we try to study them as kind of single entities. But the reality is there's as many different types of anxiety and depression as there are human beings, you know what I mean? So any one person's experience isn't going to be the same as another person's experience. And I think it's important, especially in the kind of clinical realm, to recognize what someone says. I feel like this has happened to me, and that's totally true. That's your truth. That doesn't mean that's true for someone else, or and everyone's experience is different. But yeah, so it's a bit of everything, basically. Yes, probably as you get older, you do get more anxious. Yes, potentially in this modern world, there are things that make people more anxious, but also that just might be your own personal trajectory, as it were, if that makes sense. All of the above can be true.
Is there any studies on women who tend to suffer more from anxiety because of like hormonal?
So,
Like, because obviously she's saying like obviously she didn't notice it as a younger, but now she's grown up, she's had a child. She's more likely to feel something that she's never experienced before.
Yeah, it's a good question. It's actually not that well studied. But yeah, there are, where it's best studied is in like post-child, childbirth. You have these big hormonal changes, and we know that postpartum depression is a very big thing. So we know a little bit about that, but we don't really fully understand. I mean, the truth is, we understand what anxiety is when you ask someone, are you feeling anxious? And they tell you, yes, I'm feeling anxious. We understand that, right? We understand a little bit about what's going on in the brain, doing studies with electrical shocks and so forth. But really, we're only scratching the surface, right? And, hormones, neurotransmitters, like your whole body is awash with all of these chemicals, and they're all affecting lots of different things. And again, it affects person A differently to person B. So it's almost an impossible task to try to fully understand exactly what's happening with this hormone and this hormone and that hormone. Maybe we'll get there down the line, but certainly that's probably one of the factors that contributes to women having higher incidence is probably, hormonal differences, because there are sex differences in that. But we don't really fully understand it. There are people working on it, but it's not as well studied as it should be, probably.
So how does social media impact someone's mental health?
So the short answer is we have no idea, right? And anyone telling you that we know that social media does X is just making it up, right? There is, it makes sense intuitively that being on social media 24/7, which makes it easier for social interactions to occur, which therefore makes it easier for people to be bullied, makes it easier for people to pile on. Like, it makes sense that might make people feel unwell, right? But then there are also people for whom social media is literally their livelihood, right? Influencers and so forth. So you can't ignore one and the other, right? I think it might amplify certain social tendencies, right? The way that human beings crowd around individuals and ideas and so forth might make some people more anxious, depressed, equally might make other people less anxious, depressed. So I think there is personally, I don't like being on Twitter and things like that. I know it's not good for my mental health. There are other people who love it, right? So speaking in generalized like statements saying, social media is causing an epidemic of anxiety is the sort of thing you hear people say. Like, there is actually no evidence for that. And I think with things like social media, it's going to bring good and bad. I mean, I remember Facebook, not on Facebook anymore, probably tells you what I think about social media. But I remember early on, people thinking, oh gosh, this is going to make people feel like you fear of missing out or whatever. I remember early on Facebook, you realize actually, nobody's doing anything fun. You know what I mean? Like, early on, it was like, just like, oh, you're on a party once a week. I'm not missing out on anything, right? So actually, early on, at least for me, Facebook actually made me feel less anxious because you're like, oh, no one's doing anything good. Obviously, as they become more popular and, people could curtail their image, make their image crafted a bit more, it looks like everyone's having these beautiful, wonderful time. Maybe that makes people more anxious. But the honest truth is that we just don't know. And for every argument that it might be making people worse, there are probably other people that it's making them better. I think, as with anything, in moderation, used carefully, it can probably help people. People build careers on social media, probably good for them. But yeah, we're only just beginning to understand how these things work.
It's actually funny because a lot of people who build careers on social media talk about how they're anxious and how the social media help them overcome it. So
yeah,
it's
exactly.
really just like a mixing pot of like different types of people.
Yeah, which is true about everything, right? As I say, everyone's different. There's as many types of anxiety and depression as there are individuals. So some people it's good, some people it's bad. It just depends on how you deal with it and how you make things work.
As well.
How you use it, exactly. We do know that things like social media are good at like amplifying certain bad things, right? The way that engagement, you get sort of hate speech and all that sort of stuff being amplified. That's clearly not a good thing. But, that's not necessarily the same thing as causing mental health problems, as it were. So, yeah, as someone who doesn't really like social media very much, I'm reluctant to say that it's definitely causing anxiety and depression in people, even though it would be, it's an easy thing to say. I'm not sure it's true. Yeah, it probably is, but in some people it's not. So it's,
Yeah, because people tend to be a lot meaner on the internet because they have that shield of protection being anonymous.
Keyboard warriors.
Yeah.
But then on the other hand, because it's a shield anonymous, if you're good at doing that, you can just say it doesn't matter because it's just it's just nonsense.
But if you're on the receiving end, then it does matter.
Yeah, exactly.
Yeah, I tend to use social media mostly for inspirational quotes and stuff,
ideas
like
and
Instagram.
pictures, just simple
Yeah.
stuff. I'm not trying to
I think
find
that's the good part of social media.
Yeah, exactly. Yeah.
It can build you up.
Yeah,
There's a lot
yeah.
of motivational channels and stuff.
Yeah, some networks are better for that than others.
Yeah.
Maybe
All
not
of them.
Facebook. Maybe more like
No,
YouTube,
Instagram.
like
Yeah, yeah,
videos
yeah.
that are more like this.
Yeah, exactly.
It's a bit more informational.
Why does it seem like anxiety affects a lot of adolescents more than anybody else?
I think it's because these problems emerge in adolescence. So you're a happy, smiley child. You become a teenager, you undergo adolescence, and that's when, for the people who have the vulnerability, that's when it starts to emerge. And it's because adolescence is a period of massive social change, right? You start to form peer groups, and you start to, find who you're going to find attractive, all these sorts of things, and all these hormonal changes occur. And with that, those big changes comes the precipitating factors that lead to things like anxiety and depression. Now, it's definitely possible to become anxious and depressed later in life, for sure, but just often, in general, it'll start to emerge for people who will emerge in later. It'll start to emerge when they're adolescents, just because it's a period of massive change, basically. And it may be, as you said, driven by the hormonal changes and so forth. But it's probably also just because of the way that adolescents behave and the social... You're starting to work out who you are as a human being when you're adolescent, right? You're starting to branch out on your own. And it's also a period of of a lot more risk-taking, because at the neuroscientific level, the way your brain works, you haven't quite got the control that you have as you get older, and so adolescents are famously take a lot of risks, right? And with those risks can come, bad outcomes. Start experimenting with drug use, for example, that might lead to more things down the line and so forth. So it emerges in adolescence. It's just a sort of known phenomenon.
Off of that question, sorry.
Yeah.
If you are, like, for example, a parent who has really bad anxiety, do you think that it's a possibility that you can impression your child in the same kind of like of your symptoms and the way you can that affect?
It's a very good question. So it's hard to tease these things apart, because one of the things we know is that genetics plays a strong role. So parents who are more likely to be are depressed, their children are more likely to become depressed. So one argument you might say is, well, that's because the depressed parent is making the child depressed. But actually, it's not. It's just that you both have the same underlying vulnerability that's leading to that. We just don't really know, to be honest. There is an argument to be made that certain types of behaviours are more likely to make you anxious or depressed, and certain types of parenting behaviours might. But anyone telling you that they know that that's what's happening, other than like trauma, serious abuse as a child is clearly going to lead you to become, is much more likely to lead to problems. Or not always, but beyond that, kind of more lower level stuff, it's just not clear, really.
Yeah.
You can make an argument both ways, basically.
Yeah, adolescence is a period of a lot of change, a
Yeah.
lot of where you become independent, and
Yeah.
there's a lot of body changes, a
Yeah.
lot of environmental changes and stuff.
Yeah.
But something that you said that I found very interesting was you said during COVID and the lockdown, anxiety was...
I think this is a good cautionary tale for why, when someone tells you X leads to Y, right? So if someone says social media leads to people being more anxious, you should be cautious, right? Because although that might sound obvious, it might not be true. So a good example of this was during COVID. You had lots of people saying COVID is making people more anxious. Now, obviously, it makes sense. You've got a global pandemic. You might die. That's how we felt early on. If you go outside, you might die. That's going to make people more anxious, right? But we happen to have some longitudinal studies running where we'd studied people before COVID, and we'd asked them about how anxious, how depressed they were. And just because we'd been running the studies and we needed to collect the new data, we collected some of that data during the pandemic, right? And actually, we showed that in some of our samples, anxiety actually went down, right, during the pandemic, in the real thick of it, where we weren't leaving our houses. So that, although obvious to a talking head on TV, COVID makes people anxious, right? Unless you've actually done the research, you don't know for sure that that's true. And actually, one of the reasons I think with anxiety is that it depends on the type of anxiety you have, right? We talked earlier about social anxiety. If you're socially anxious and now you're not allowed to leave the house, well, that's a relief, right? Yeah. I don't have to talk to people, right? I choose when to talk to people, right? So I think with any of these things, that's a good example of where simplistic messages, you actually have to do the work to see. And no one's, there are people working on the relationship, for example, between social media and mental health, but the story might be much more complicated than it seems at first glance, if that makes sense. And obviously, for some people, COVID was terrible, right? It's not to say that COVID was great for everyone's mental health. It's just to say that there are certain people for whom it was actually, for a short period of time anyway, was actually helpful for them. It's just that everything's complex and everything interacts in complicated ways. And mental health, going back to the point I keep making over and over again, it depends on the individual and what your environment is, what your circumstances are, how you react to certain things.
So on the topic of social media, are there any apps or websites that you would recommend people looking for support or information regarding mental health?
So I would say be very, very careful. I would generally say go to the NHS websites, go to your GP if you're worried about your mental health. There are private therapists you can access, but I would always start with seeing your GP. The reason for this, it's a wild west. There are lots of apps out there claiming they can do X, Y, Z. I've worked with some of these companies, and I know that the evidence base just isn't there for most of these things. And you've got to be very careful about, if someone's really anxious, really depressed, and having them do something that's not helpful is not a good idea. So always talk to a healthcare provider. There are digital app-based solutions that do work, but they will almost always be accessed through a healthcare provider. They won't be something you can Google, essentially. Google, in a sense, is not ideal because you can find all sorts of terrible stuff out there. Having said that, again, whatever gets you through the day, right? So if you find that certain types of soothing music or whatever helps with your anxiety, that's brilliant. Go for it, right? But if you're really, really feeling unwell, if you're really anxious, really depressed, or someone that is, because oftentimes people don't necessarily recognize it that much in themselves, or they're not, especially when you're depressed, you just might not want to do anything. It's important that you get them to see a healthcare provider.
Yeah.
Which is, following that question, if you are a person who's anxious and find it hard to call the doctors,
yeah,
what would you suggest as you can't?
Well, that's a good question. I mean, yeah, that's a really good question. I would say there are websites. So if you go to the NHS website, there will be advice there that you can do without talking to somebody. There are things like NHS 111. There are phone lines, mental health. If you go to charities, like there's charity Mind. They have resources for people that don't necessarily involve seeing a healthcare provider. They might have drop-in sessions. They might have places you can go. Like half the battle with mental health is recognizing that there's an issue and trying to do something about it. And often for many people, just that process of trying to do something about it is all they need. That gets them out of the house and that helps them. But it is a challenge. And the other thing to be honest about is that the mental health care provision we have is good for those who are able to get into the system, but the waiting lists for things like psychological therapy are just too long. That's not really my area, but that's something we need to fix down the line. But unfortunately, there aren't any quick fixes. You might be able to find an app. I mean, I don't want to leave you the idea that you could download some app. It's actually bad for you. But if someone's really, really anxious and depressed, it's probably not going to be very helpful.
Well, there are like meditating apps.
Yeah.
What was I used to have
So
one
like
called Calm or something. It had like specific breathing. Oh, was the one there? Have you seen? It's the one with the orange thing, and it's like breathe in, breathe out.
Headspace.
There you go.
So this is actually, these apps have aspects of one of the types of therapy we call mindfulness therapy. It's basically kind of like Eastern philosophy packaged as a mental health treatment, which actually again can work really well for some people. The problem is it doesn't work for others, right? So some people mindfulness is actually actively harmful. So some of the aspects of mindfulness are like sit there and allow the thoughts to happen.
Yeah.
In some people, that actually makes them worse. In some people, it helps, right? This is why I think it's important to work with a healthcare provider, because they know all the different options available to you. So there's a whole other set of therapies called cognitive behavioral therapy. In many aspects, they're almost the opposite of how mindfulness works. Both of them are successful in some individuals. We don't know who will respond to which, but you don't want to try something, it not work, and then be like, well, there's nothing for me, because there are many options out there. But yes, if something like meditation, guided meditation through the Headspace app, for example, is helpful for you, then that's brilliant. But I don't want people to get the idea that there's a quick fix here, that you download an app and you solve stuff. And I also don't want people to think that if that app doesn't work for them, that therapy doesn't work for them, or that treatment doesn't work for them. And again, in some people, medication is the only thing that will work for them, in about 25% of people, something like that. So there's no app you're going to download that's going to help you. You need to see a clinician and get prescribed something. Again, it depends on the individual. But I'd be very hesitant to say, when we're talking about extreme anxiety and depression, like clinical, there's no app that's probably going to help you, really, on its own.
What are some common misconceptions or stereotypes about mental health?
I mean, stigma is a big one. It's getting better. It's not as bad as it used to be, but the idea that, you know, if you're anxious or depressed, you're weak, or, you know, that it's all in your head, you know. Sure, it is all in your head and your body, your feelings, anxiety and depression, but that doesn't mean it's not a thing, you know, just because it isn't something that you can ascribe to like some specific physical cause. Like, you know, a broken leg is a broken bone. It's not in your head, it's a broken bone. Mental health problems, in a sense, are all in your head because that's what mental health is. That doesn't make it less bad than a broken bone. If anything, it actually makes it more complicated than the broken bone because we don't really understand our heads or our psychology very much. So, the biggest misconception, I think, is that A, it's some sort of sign of weakness, or B, that because it's sort of in your head, it therefore, you know, it's not a real thing and you can sort of get over it, as it were. I think those are the two biggest misconceptions.
So how helpful would you say is therapy for anxiety, and what other options are available for those who are suffering?
So for some people, therapy is perfect and it solves all their problems, right? That's probably about half, maybe a little bit lower than. We know this from our like treatment services. If you get into a treatment service, about 50% of people will show some kind of improvement. They might not get completely better, but they'll get some kind of improvement. So about half of people, some kind of therapy, and there are lots of different flavors of therapy, will work for them. But that means that for half of people, they won't work, right? And what that means is that, like, if you engage in therapy and it doesn't work for you, you're going to be spending a lot of time with a therapist, maybe a lot of money if you're doing it privately, and it doesn't help, right? So that's, you know, for the people it helps, it's great. For the people it doesn't help, it's not great. And it can lead people to be frustrated with the system, right? Other treatments we have are medication. Now, there's really one main class of medication, which is selective serotonin reuptake inhibitors. That's the sort of primary treatment. These are also known as antidepressants, Prozac, you know, they're all kind of the same thing. That works for maybe a quarter to a third of people, some of whom are the people who the therapy doesn't work for, okay? But again, a large number of people, the medications do not work. There are some other types of medication that you might be prescribed. There's one called pregabalin. There are things like very fast-acting things called benzodiazepines, which you might be prescribed very, very short period of time. They're very addictive, so you can't use them chronically, but you can use them if, you know, for a very short period of time. It can make people very, much less anxious. But that's basically all we have. We have a few medications and we have a few different classes of therapy. There is still a subset of people, this is why I study this, there is still a group of people, maybe about a quarter, maybe about a third, for whom nothing we have works. Absolutely nothing, right? And this is why it's not good enough, the situation we have, why I study what I study, because I don't think we're going to be able to close that gap without fully understanding how the brain leads to things like anxiety and depression. But critically, going back to the point earlier, talk to your GP. Your GP will be able to funnel you into different avenues of treatment, whether it be medication, whether it be psychological therapy. And the key thing is to know is that you don't know in advance whether you'll respond to one or the other. And certain people might not want to take medication, certain people might not want to do therapy, but that doesn't necessarily mean that they will or won't work for you. And the important thing is to know that as it stands now, it's going to take a while, right? You might get lucky and the first thing you try works, if so, brilliant. But for most people, it's a trial and error process of trying different things that doesn't work. And nothing is without side effects. The medications have side effects, the therapy has side effects. And so it's really important that you work with someone who's trained in this to try and find what works for you.
What are some useful coping methods and techniques you can do to help yourself if you're struggling with anxiety?
So I'll go back to my point again. If you're really struggling, go see a healthcare provider, right? But if it's the sort of mild level anxiety that's not really getting in the way too much, but it's bothering you, yes, you can try different techniques. So there are therapy-based techniques, so mindfulness-based techniques might help you, things like meditation, things like calming music, and so forth. There are specific tools. You can get a book about cognitive behavioral therapy and read about how that works, about reframing situations, things like that. You can do a bit of research into that. Again, it's better with both of these to see a therapist, but again, if it's low level, maybe you might be able to read about this and help yourself out. Exercise is an excellent help for lots of people, right? Not for everyone, but getting out there, even if it's just a short walk or if it's going for a run. I know myself, like I need to run, multiple days a week, otherwise I start to feel really anxious and really depressed. I feel lots of energy built up in my body. That's not for everyone, but again, that's a sort of technique that might help you. But whatever works for you really is the answer. In many cases, just the simple thought of, oh, I'm a bit anxious, and recognizing it might actually help you. That might be all you need. But basically, if you're really, really unwell, go see a doctor, go see your GP, and there's no substitute for getting actual clinical help.
Yeah. If you're in an anxious situation, trying to take your mind off of what's causing the anxiousness could help.
Yeah, but that might work for some people, it doesn't work for other people. So some people saying, right, don't think about the thing, that might help you. Other people, it really doesn't help them at all. And so that's the difference. In one of the cases, that's one of the differences between mindfulness. Mindfulness might be let it wash over you. And in other kinds of cognitive approaches, it might be try and think about something different or frame it in a different way. These tools, you just have to work out for yourself, generally with the help of someone who's trained, what works for you and what doesn't work for you. If you're lucky, you can kind of work it out for yourself. But it's it's if you're really anxious and depressed, there's no substitute for someone who's seen it lots. And then this is the thing to remember. It's probably a good point to end on, is that it's very common, right? And so when you see a therapist, it will not be their first rodeo, right? When you have these feelings, it can feel like you are the only person in the world that suffers from this. You're the only person who has these crazy ideas, these crazy thoughts. You are not, right? That's not to say that it's not important. Obviously, it's really important, but it is to say that there are people who day in, day out work with this and are able to help. So yeah, that would be my sort of take-home message. You are not alone. Speak to somebody.
Okay. Thank you so much, Dr. Oliver Robinson, for meeting us today. It's been so informative to talk to you.
So thank you for joining us on our final episode. Thank you for all our special guests that we've had, and thank you for watching, all of you people.
And a big thank you to UCL and Future Formed for making this podcast happen. A big thank you to Iman for being my co-host, wonderful co-host.
And Shakira for being an amazing producer.
And once again, thank you, Dr. Oliver Robinson, for joining us.